All right, Sabra Minoka say there's something which is going on in the health ministry. Amanfo bebree eka wan say that's sorry. Mahama have laid three big major interventions in the health ministry, and these particular interventions, it is affecting our nurses. Now, what is really going on? For the starters, that's sorry. A press release about a part to say nurses, school fees or mutiano Mahama actually pay. 50%. Aside from that, too, nurses will now be able to travel to 8 countries to be able to go and work there and take heavy salary. Aside from that, too, over 7,000 nurses are needing to biaka amaya so then to payroll. So now let's put this on the screens because it's very important for you to know exactly where we are going. To share we feed the Ministry of Health or press release we buy in really or say admission fees for nursing trainees reduced by half. Number one, the Ministry of Health wishes to inform the general public and all stakeholders that effective the 2025-2026 academic year, school fees for nursing and allied health training students have been reduced by 50%. So, not just the nursing students, allied health training students. To one or more a year midwifery or midwifery, a year physicians assistants. All of these people they are part of the broad scope of nurses. Almost school fees. Two, the intervention has been made possible through the introduction of government flagship no fee stress policy for tertiary students across the country. So this, according to them, is based on an intervention program the John Dramani Mahama administration brought out. And this particular intervention program, a no fee stress policy. And remember, say just some few weeks ago, few months ago, in more various universities are almost called level 100. This particular for almost school fees it has been returned to them, and this is all part of the policy, the no fee stress policy NDC implementing. And so our policy, it has now extended to nurses at the various health schools and also its allied education departments. 3. By this initiative, government have absorbed half of the approved fees for all first-year students enrolled in nursing and allied health training institutes. So they are saying, the cost when you say be a for it, the government will take this particular course. 4. All institutions are strictly required to adhere to approved fees and items as communicated by the ministry. So they are saying, all ministry stakeholders, you guys need to know, this fees now you can one say 3,000, you pay to 1,500. So this is definitely a good initiative. Number 5, no institution is permitted to charge above the approved amount or demand payment for items covered under policy. Yes, institution now. More chrome has say muji fees and forms near that also so you can't do things as you did previously. 6. The reduction fulfills the commitment of His Excellency the President of the Republic of Ghana, John Dramani Mahama, to provide financial relief for parents and students who are determined to pursue their academic and professional dreams. This is one thing that His Excellency John Dramani Mahama is doing. Sorry, say other part of the press release in or say this is the reduction is part of His Excellency John Dramani Mahama. The fulfillment is your say students, any parents are mutual fees mobre so mobre to ebicha and I say sika na ka mo bone beba fem. 7. The Ministry of Health hereby advises principals of health training institutions to comply fully with the directive. Any principal who contravenes this directive or imposes unauthorized fees does so at his or her own peril. So they are saying, any person or bet try say or bet above the stipulated amount, you will be sacked. I'll not mean swear say above, and I say I'll not mean swear say the person who does so at his own peril. You will be sacked. You'll be jailed because fees go by it and don't try to use your mind on innocent parents and students, their fees. 8. The ministry remains committed to safeguarding the welfare of students and advancing equitable access to health training education. I think the ministry is very much committed to making sure that day in, day out, and as time goes on, more of these intervention programs will happen. 9. By this notice, heads of health training institutions are directed to commence the necessary processes leading to the admission of students for the 2025-2026 academic year, signed by Tony Goodman. So they are saying, this whole thing, it is applying now, and aside from that, in Yanuma, or motor forms to go 2025-26 academic year, no, one more motor was here, some person nursing school, no, it is a fees on between a half. So clearly, this is a very good news and a very big one for the nurses, and also it shows that His Excellency John Dramani Mahama, he is committed to working. So far, oba abemu bibi okaso be bia waye reduce dollar what fees no so wasan so the first year student fees amomo nurses ye mo kama what masie we yi betting tax if you it is a deben kran ye mamu bium. But Mahama says it doesn't stop there. Sheha or say Mahama directs appointees to expedite labor mobility agreements to enable Ghana export nurses to 8 countries. So now they are saying say the Ministry of Health and also the labor mobility no acquiring an anyama also more here to make sure say nurses or more kroma say they can be sent to other countries, not just say countries or more third world and developing countries, developed countries like US, Canada and so. Omunya agreement ni intimi exporting nurses inti wo ye nurse wo kroma na person be ye adwuma wo Ghana. Why not? Canada wo ho, UK wo ho, US wo ho, Brazil wo ho, China wo ho, Cuba wo ho, Canada wo ho. You can go and work at all of these facilities. So this is just second part of the whole good thing that Mahama aired and air. And aside from all of that, listen to this. Also, 7,000 previously unpaid nurses are now receiving monthly salaries. Government is still working to migrate the remaining numbers. So now we are learning clearly, say, these particular things are air costono. 7,000 nurses are enkania buying, they were not paying them. NSS Canada, they were using the money in their pockets. No, Mahama said all those sika are caught into the pockets of these officials. No, we will pay you. So 7,000 previously unpaid nurses. No, they are now receiving monthly salaries, and also no Ghana, they are making sure say they will migrate them. Okay, so one more minute they can get work, and also no remaining numbers now akano, and I won't into mokano they will also follow suit. So clearly this is a whole big win for Ghana. But then in other news too, the Ghana Nurses and Midwifery Council omudi ababe tuja say abayewa no see Raf. Okay, Raf for cost to me Rage, it is a tawantawa, leading see a bow now, a china bandage on the left hand, and then bandage on the right hand, a china or the bandage as on the kum, Yakoya SUS, no. Ghana Midwifery Council and Nurses Council party said they will sponsor the lady to sue Raf. Yesterday, I seen they have a video, but up to now, video in the empire. You could see your PR in some of the two joy by a better also. Yabekoso, Abayuano, Eco Court. Support to be a war. And
any question in it all court, you know, evidence bearing or the court is a footage in you.
I've shown you like 2 evidences here. I've given you the medical report that came to confirm. That is enough evidence. I've given you the limbs information or committee is what say we need here or and yet the same doctor
subluxation nursing doctor to me actually am a woman say and a hono. That is the diagnosis. Na de chen yetimi
football kro mo ma bobo dan waba obo no waba say ya de hwa eno ano obete pain obete yaw no obete bibia no but onsan be ya adwuma
ase efrichi yenti yedi kansi ani a
o ka say efrichi ya it is different
eni a kire ye ni enti ase because ya yin say no obi ani ha yi de na
no kire say ebu
esue no entimi anya ma na se preko pa se ye kwa committee
e tokro ene etirese ai o shoulder no o hono tokro ene etirese
nti o ka na ye no na ha ye tokro
ana hono ye tokro ene shemu sei enti se me bob men sa sei na eyi fere ho sei ya me de shemu ana akwhye de obetie ye yawo any area readiness ebeba ehono say we obi a yakoko kakra yaw no de obeti because muscles na ewo ho no emu betwe enti say wokotwa elsewhere we ni a ehye ho no de akose mu dada
ena de na ebema etire no ahun afri to
say ebi a obeti ahwe obi bebo wonsa say and I say harm any cause of harm ebeba around the limb whether left or right limb ni bia no ebetimi ama onsa ho no wabeti ho no eyi bebre womo a ye ani abobo no omo mbobo ne de eyi de bia etimi yi na wa wo de ahye wo manova no a ebe hye sisi e wo ye obi a wonim ya wo so ha ye chia no style bi gbon se no asa akwa nipa kro ne obi otimi di ne tirim a obetimi de aye de wo ye bia yawo ne de obeti I be treating I rejoice at the hospital ho free adana Monday na asem ne si ye no kupim Tuesday Thursday ya etwam na omuyi
nano ya wade
ya na omuyi ni free hospital
but so, committee no say o mu treating no 18th no e ma no ko man ka say ya hospitalizing na so wade
me catch us say we yen ya report
at the time a committee no report in by kwa na rejoice e wade hospital sir
yes
I see mu make we say committee no mu nipa ni so almost set up committee no say mu hu ye ada na man protest say mu ma nurse ni mra so
Ghana Health Service disciplinary code of conduct na emra ewom we understand say the ministry knows Ghana Health Service omom to no say ye investigative committee ekohwehwe enye nurse for kwa doctor ni asemu a was say the GMA Ghana Medical Association enipa was our committee no so say Health Service Workers Union enipa anase omuduma eni na ye kohwehwe na semu Health Service Workers Union ebema enipa amu akotena so sanso na say asem no fa nurse ni eho a was say ministry no ene Ghana Registered Nurse and Midwife Association ekasa na omuyi nipa na okotena committee no eso na ohwe se pepepe eno no kwadi ebekoso the ministry didn't do that
na me say na mo man ka say committee ya mo yi de ase ya 75 ho kra no mo ye pemu
meka say enye se ye kan ya no tum
mo kan
yeah whatever cause enye bibia na betuma ba bontia be de so omon free no whatever communication I was ye ni nya because in any case we expected them to do a good job yeah she say ombeye adwuma pa ebeso Ghana ni bia na edi moral na e call for
no pray the mo de call so anka mo so mo side no bebe ma sense nei afi na report ni yenye ntum they didn't do a good job
yeah say your side ebe yeah reporter yeah pe
no more rep
it is good say I was saying can rep so I was say that is what the conduct states say I was say a rep Ghana Registered Nurse and Midwife Association no association a rep so that is what it said but we were good enough say yenim say committee until report eba bonten na ye share gaps na ye share nipa the principal witness we doctor ni mpo ya hono na it raise more concern to us say it looks say the committee is hurry to vindicate people rather than finding solution to at the chrono as in